Hello, Dr. Praveen, ma'am. Can we start, ma'am?
Yes, ma'am.
Yes, ma'am. Thank you. Firstly, it's my humble request to everyone to please keep your mics off during the session to avoid any inconvenience during the session. वेरी गुड आफ्टरनून, नमस्ते वन एंड ऑल। मैं डॉक्टर पूनम वाजपेयी राष्ट्रीय आयुर्वेद विद्यापीठ की संपूर्ण टीम की ओर से सबसे पहले हमारे इस सत्र में उपस्थित सभी आदरणीय अतिथियों को, सम्माननीय हमारे गवर्निंग बॉडी मेंबर्स, हमारे सभी आदरणीय गुरुजन, सभी शिष्यों का आरएवी की टीम की ओर से हार्दिक स्वागत करती हूँ और सभी आदरणीय जनों को हार्दिक बधाई एवं शुभकामनाएं देती हूँ कि आप सभी के सराहनीय सहभाग, सहकारिता एवं आशीर्वाद के चलते आज हम ज्ञान गंगा वीकली वेबिनार सीरीज के 150वें ऐतिहासिक सत्र में पदार्पण कर चुके हैं और इस प्लेटफॉर्म से जुड़े सभी एक्सपर्ट स्पीकर्स जिन्होंने इन 150 सत्र पूर्ति में अपना विशेष ज्ञान रूपी योगदान दिया है, इसके लिए आरएवी सदैव उनका हृदय से आभारी भी रहेगा। जैसे कि आप सभी जानते हैं, यह ज्ञान गंगा वीकली वेबिनार सीरीज की शुरुआत कोविड महामारी के दौरान हुई थी, जो वो भी इस उद्देश्य के साथ नॉलेज एंड लर्निंग शुड नेवर स्टॉप। सो 20 जुलाई 2020 से प्रारंभ की गई यह ज्ञान गंगा सीरीज आप सभी के उत्स्फूर्त सहभाग से अविरत रूप से चल रही है। आप सभी को सादर नमन। साथ ही हमारे जो मार्गदर्शक है आदरणीय पद्म भूषण वैद्य देवेंद्र त्रिगुणा जी, प्रेसिडेंट ऑफ गवर्निंग बॉडी आरएवी, रिस्पेक्टेड डॉक्टर वैद्य मनोज नेस्टी जी, रिस्पेक्टेड डॉक्टर कौस्तुभ उपाध्याय सर, एडवाइजर ऑफ आयुर्वेदा, मिनिस्ट्री ऑफ आयुष, आदरणीय डॉक्टर वंदना सिरोहा मैम, डायरेक्टर ऑफ आरएवी, इन्हें भी इनके अभूतपूर्व मार्गदर्शन, प्रोत्साहन एवं प्रेरणा देने हेतु, एनकरेजमेंट हेतु मैं धन्यवाद देती हूँ। आज जैसे कि आप सभी जानते हैं, आज का सत्र जो है बेहद ही खास इसलिए है क्योंकि आज ज्ञान गंगा ने अपने 150 सत्र यशस्वी रूप से पूर्ण किया है और साथ ही आज हमारे बीच दो एक्सपर्ट है हमारे बीच। फर्स्ट एक्सपर्ट के बारे में आपको बताऊं, साथ ही आज जो हमारी पहली एक्सपर्ट है रिस्पेक्टेड डॉक्टर प्रवीणा पी नायर मैम, जो कि सीआरएवी शिक्षा में रह चुकी है और नेत्र चिकित्सा में सीआरएवी पाठ्यक्रम पूर्ण कर आज यशस्वी रूप से मंदसौर इंस्टीट्यूट ऑफ एंड रिसर्च कॉलेज मंदसौर मध्य प्रदेश में एसोसिएट प्रोफेसर एवं विभाग अध्यक्ष के तौर पर सेवारत है। और आज इस सत्र में हम सभी को नेत्र चिकित्सा एंड प्रैक्टिकल अप्रोच इस विषय पर संबोधित करेंगी। साथ ही हमारे साथ दूसरे एक्सपर्ट हमारे साथ है आज मैसूर के जेएसएस आयुर्वेद मेडिकल कॉलेज के तंत्र विभाग में प्रोफेसर एवं प्रिंसिपल रिस्पेक्टेड डॉक्टर सर्वेश्वर कर सर, जो भी आज हमारे बीच अपनी क्रियाकल्प की इन 25 वर्षों की एक्सपर्टीज को, अपने एक्सपीरियंस को हम सभी के साथ साझा करेंगे, जिसमें इतने वर्षों के अनुभव से प्राप्त उनका जो ज्ञान है उसको एक वीडियो द्वारा वे शेयर करेंगे, जिसमें उन्होंने 7 क्रियाकल्पों को स्टैंडर्ड प्रोटोकॉल द्वारा किस तरह किया जाता है इस पर वे मार्गदर्शन करेंगे। सो वी वेलकम यू रिस्पेक्टेड डॉक्टर सर्वेश्वर कर सर एंड डॉक्टर प्रवीणा नायर मैम। सत्र की शुरुआत करते हैं अश्विनी सुक्तम द्वारा। मैं रिस्पेक्टेड डॉक्टर अर्पिता मैम से अनुरोध करती हूँ कि वे अश्विनी सुक्त का पाठ हम सबके लिए करें। आई वेलकम यू डॉक्टर अर्पिता।
Thank you. श्री गुरुभ्यो नमः। हरिः ओम्। द्रावा आणेव तदिदर्थं जरेथे गृध्रे एव वृक्षं निधिमन्तमच्च ब्रह्मणे एव विदथ मुक्तशासा आधूते बहव्याजन्या आपुरुद्रा प्रातर्या वा आणारथ्ये एव वीराज यमा परमा सचेते मेने इव धन्वा शुम्भमाने दम्पतिवक्रतु विराजनेषु शुङ्गे एव न प्रथमागन्तमर्वाक् छभावि भजर्घोराणातरोभिः चक्रवाके प्रतिवस्तो रुस्रार्वाञ्चा आयातं रथ्ये एव शक्रा नावे वनः पारयतं युगे वनभ्ये एव नमुपधीव प्रधिव श्वाने एव नो अरिषण्याधनूनां कृतरेव विस्रसः पातमस्मान् वाते एव नद्ये एव रीतिरक्षे इव चक्षुषा या आतमर्वाक् हस्ता आविवतन्वे एषं विष्ठापादेन यतिम्बसो अच्छा ओष्ठामद्वास्मे वदन्त तन्वो रक्षिताः कर्णाविव सुश्रुताः भूतमस्मे हस्ते एवमभिसन्धदीनः क्षामे एव नः समजतं रजांसि भीमा गिरो अश्विनायुष्मयन्तीः क्षोत्रेण स्फटितिं संशिष्टम् एतानि वामश्विना
Hello, Dr. Arpita ma'am.
येषवां देवावश्विना कुमारः साह देव्यः दीर्घायुरस्तु सोमकः तं ध्रुवं देवावश्विना कुमारं साह देव्यं दीर्घायुषं कृणोतना हरोम्.
Yes, thank you, Dr. Arpita ma'am, for wonderful enchanting of this Ashwini Suktam and spreading great positivity. I think N. Ramakrishnan sir has also joined, admin officer from RAD. Sir, would you like to say something? Few words for all of us. Ramakrishnan sir. Hello, Ramakrishnan sir. No sir, no sir. Please unmute your mic, sir. Hello. Hello. No sir, you are not audible. Just a moment. There might be some technical glitch, that's why. Sir, would like to share a few words for all of us. All are requested to please be here and stay connected. This will be a wonderful session for all of us. Just within a second, we will commence with the session. There is some minute technical glitch, that's why. Sir would be addressing us. Yes, sir. Not audible, sir. No, no, not audible, sir. Okay. Yes. Can we continue, sir? Okay. Now, I would like to share the brief introduction of respected Dr. Praveena Nair, ma'am. Ma'am is serving as Associate Professor and Head of Department at Department of Shalakitandra from Mandsaur Institute of Ayurvedic Education and Research, Mandsaur, Madhya Pradesh. Ma'am has earned her BMS from Government Ayurved Medical College, Kannur, and she is KGK Panikkar Award winner for the best ongoing Ayurvedic graduates of Kerala from all the Ayurveda colleges of Kerala for the year 2007. She is also ex-CRA Visheshya in Netra Chikitsa in the year 2010. She has earned MS degree in Shalakitrantra from Sri JGCHS Ayurvedic Medical College, Ghataprabha with first class. She is a registered Reiki practitioner and healer and also NLP trainer for neuro-linguistic programming. She has rendered her services at Government Ayurveda Medical College, Pariyaram, Kannur, Trivandrum, Government Ayurveda Mental Hospital, Kottakkal, Malappuram. She is first rank holder in BMS from Kannur University and she is also national player of cycle polo and represented Kerala and won second prize in National Cycle Polo Championship held at Uttar Pradesh. She has received Ayur Visharad Award for the year 2007 and Father Vargottini Award for the Best Cycle Polo Player. She has judged many events, including Nava Vedic Award for the year 2018, and presented several papers in both national and international seminars and published several articles. Currently, she is pursuing a PhD in Shalakya Tantra from Parul University, and she has also compilations on adrenal disorder, esophageal disorders, and Soralia carifolia drug study. So, without much delay, I would like to request Dr. Praveena Nair ma'am to please proceed with her deliberation. We welcome you, ma'am, on behalf of RAV. Please unmute your mic, ma'am. Yes.
Thank you for a wonderful introduction.
Hello.
Yes, sir.
Hello.
Yes, sir. Yes,
Can you hear me now?
Yes, sir. Yes, sir. You're audible, sir.
Oh, thank you. At last I was able to join. Good afternoon, everyone. Especially to Praveena and Karsab. After a long time, I'm meeting him. So I am very immensely happy. So on both occasions, one is Karsab is our external. He used to RAV's external teacher. So that is one pleasure. He has done a lot of examinations for RAV students. And then I need not to talk about much about Praveena. Praveena's name should be Prerna actually for all our students, because she was our homegrown. I still remember 2010 batch. I only selected her in Kottakkal. So she was there in the interview, and she joined E2D Bodhasan Nambudiri sir, and then she graduated herself. One thing I tell you, she was an extraordinary student. What important is she was meticulous. She was hardworking, meticulous, and she went on up and up in her life. And she will go further also. It is not the end. She has now reached a pinnacle. And today, all our students, all CRI students should take from Prerna from Praveena. So she is more Prerna to all, because how a ordinary BAMS graduate, after doing CRAB in Salakya, how she has developed herself into now she is an associate HOD, and probably she will be a professor one day, and then she'll a PhD also in Shalakya Tantra, and she is going to do more and more research and other things, and she is going to get more students. I'm really happy now the student has become the teacher, and one day she'll become RAV guru also. So I am waiting for the day to see that Praveena becomes RAV teacher also, because this is second generation is coming up. One is MRAV gurus. MRAV gurus used to be our first batch students, and they become gurus in our RAV. Now they turn for CRAV students also to become gurus. And people like Mr. Kar will also they're always helpful, because I know he was a principal in Sri Sri Ayurved College and helped RAV in many conducting programs that in Sri Sri. Now he's in JSS Mysore, and he's still calling me as to do some program there also. We'll do some program also, because Mr. Kar used to be the Shalakya external teacher, external examiner for RAV. He used to come for our exams. Because due to his busy schedule nowadays, he cannot able to come. Previously, he used to come. So it's a lovely day for me to meet both of them. Both are good friends of RAV, and Praveena is our student also. And probably Praveena will be one day RAV guru also. So I wish her all the best in her life. Thank you, Praveena, to doing this. Please continue. I hand over to Poonam.
Sir, one word from me. Sir, one word from me. I have a lot of gratitude to you and the RAV as well. And I am really fortunate to be part of this knowledge session. I thanks everyone, including all the RAV's authorities, for giving opportunities. Thank you. Over to you, sir. Thank you.
Yes. Thank you, sir. Wonderfully said, sir. She would be definitely serve as a wonderful inspiration and motivation to all the CRB sisters. So now, without much delay, I request ma'am to please proceed for her presentation. Welcome, ma'am. Welcome, sir.
Let me start the share.
Yes, ma'am.
I hope it's visible now.
Not yet, ma'am. Click on PPT itself, ma'am.
Okay.
You have done entire screen, now. Then click on PPT.
Okay.
Are you sharing, ma'am?
Yes.
Yeah. You have done entire
Is
screen,
it-
ma'am. Now, yeah. Now open PPT, ma'am.
PPT is open, ma'am.
Not yet, ma'am.
Okay.
You have clicked on entire screen, ma'am.
One second.
Hello.
It's window.
No. You have clicked on entire screen, the third option. Then you have to open.
No,
the
ma'am.
हाँ
And that screen click करना था.
हाँ
No,
entire
win-
screen कर दीजिए मैम. Then उसके बाद में आप PPT open कर लीजिए. That will be open then.
Okay.
हाँ entire screen कर दीजिए.
Is it visible?
Not yet, ma'am. Now
Is it
open the
visible,
PPT.
ma'am?
Yes,
Yes.
ma'am. Now make it slideshow. That is visible. Please proceed.
Is it visible, ma'am?
Yes, ma'am. Full screen. Yes.
Okay.
Please proceed.
So before starting, let me thank all the CRAV team for giving an opportunity in this prestigious platform and a wonderful introduction also. With the blessings of all my gurus, let me start. Gurave sarvalokanam vishaje bhavaroginam nidhaye sarva vidyanam Sri Dakshinamurtaye Namah. So our topic is Netra Kriya Kalpas and a practical approach. So the contents of the paper, it includes the relevance, introduction, queries. See, while we are starting the Kriya Kalpa, the main practical query that we will be having is what to do. Obviously, it is Kriya Kalpa, but where to do, whether in the anterior segment or in the posterior segment disorder, and why to do. Obviously, it is for the disease clearance. But again, there are some queries in this area also. Then when to do, which procedure, which mode, and which drug. How to do and how it works. So these are the main contents of our paper. Our Ayurvedic Kriya Kalpa is competent with the modern ocular drug delivery system. And it checks the barriers, that is physiological and anatomical. Why? Because our Kriya Kalpas are having more tissue contact time and more bioavailability compared to the modern drug delivery system. So these are the main importance why we are doing our Kriya Kalpas in a very important way. I'm not going into the introduction and all. See, now we'll be going to the practical approach. Okay. So we all know the Kriya Kalpas. It is explained like Charaka 3 explained kiya hai, Vagbada 4, 5, Sushruta 5, Shargadara 7, and extras. These are also important. We are having Avagundana, Avachurnana, and Muti. And this Avagundana is also called Brahmana or Gundana. And all these are explained in Ashtangruti Uttara Tantra also. And now the query is, where in the eyes? We all know the eye is divided into anterior segment and posterior segment. So anterior segment includes the anterior portion including the lens, and posterior segment is behind the lens. So all the 7 Kriya Kalpas along with the 3 extra that I have told will be working on the anterior segment. But what about the posterior segment disorders? We are having mainly Anjana, Tarpana, and Pudpaga that is acting on the posterior segment disorders. And that is the main attraction of Ayurvedic Kriya Kalpas in compared to this modern era of this modern ophthalmology also. They are almost helpless in tackling the disorders in the posterior segment. And there is the glory of our Kriya Kalpas. And obviously in the Ednatsa, that is all the 7 Kriya Kalpas along with the 3 Kriya Kalpas will be having main action. And why we are going to do this Kriya Kalpa? So there should be a mode of action while we are doing this Kriya Kalpas. And what is that? Am I audible?
Yes, ma'am. Yes, ma'am.
Okay. So what is the physiology behind the action? Gatva santi sirograna mukha srotamsi bheshajam urdhvaga nayane nyastam apavartayate malam. See, if we are applying some drug in the eye, it will go into santi, shiras, grana, mukha, etc. and it will be expelling the doshas. And here we should also remember about the nasya. And what is nasya? Jo bhi urdhvagat rujat rog hai, we have to go for nasya. And how it will act? It will reach the Srota Sringataka. So the same mode of action will be there here also, because it is going to Shiras also. Okay. Gatva santi shira yasira grana mukha srodamsi beshajam urdhvagan nayane nyastam apavartayate malan. And the next thing is we should know about the concept of abhishanda. This abhishanda is not the communicable disease abhishanda, that is prasangat gatra samsparshat wala abhishanda nahi hai, and this is also not the abhishanda that is explained in the Sarvakshigata Roga. Susruta had explained the abhishanda as the root cause of all the disorders, isn't it? And we all know that prayena sarve nayanamayastu bhavandyabhishyanda nimitta moola tasmat abhishyandam upekshyamanam upacharet ashuhitaya dhiman. And there also Kriya Kalpa will work. And what about the concept of ama nirama in eyes? And here we are doing mainly mistakes in this area while doing this ama nirama vivechana in the eye. And see, we are having 7 Kriya Kalpas or 7 plus 3 Kriya Kalpas, but how we are failing means we are not having the correct sama nirama vivechana in this akshi. And all of us should remember the sloka. Akshi kukshi bhavaroka pratishyaya vranajwaraha panchede pancharatranam prasamam yati langhanat. See, Akshikata Roga needs Amapachana or Langhana in the first stage. So if in the first stage you are going for some treatment or some Kriya Kalpa which is intended for the Nirama Avastha, obviously it will cause problem to your eye. And one more thing is, we should go through all the Vyadhi Ghadagas. And if you are not having the idea of Vyadhi Ghadagas, then also your Kriya Kalpa won't work. Then Chayadi and Vyadhyavastha, all of us know. जो निदान आते हैं उसके बाद जो संप्राप्ति आते हैं सिराभिरूर्ध्वं प्रसृता नेत्र अवयवमाश्रिताः वत्मं संधिं सितं दृष्टिं then sarvamakshimva rogan drishti sarvamakshimva rogan kuryuhu. So all these area will be having the disease as per the chayadi and vyadhyavastha. And of course we have to follow the basic this examination or basic workout before starting our Kriya Kalpa. What are they? Dushyam, Desham, Balam, Kalam, Analam, Prakritim, Vaya, Sattvam, Satmyam, Tadhaharam, Avasthascha Pradakvidaha, Sukshma, Samiksha Esha, Arabhe, Tatakriyam. Here, what is the Kriya? It is the Kriya Kalpa. So, we have to go through all these 10 factors before starting this Kriya Kalpa also. And before going to the mode of action, we should go through the modern counterpart of this action also. So we are having the anterior segment and the posterior segment. So we'll be having the topical administration. In what will happen in topical administration, we are having the corneal route and the non-corneal route. And through this corneal route, we are having transcorneal entry of the medicine and paracorneal entry or paracellular entry of the medicine. What is the importance of this? We are having 2 barriers there. Okay, so we are having a lipophilic drug and a hydrophilic drug. So if a lipophilic drug like a grida should penetrate into the cornea and should reach the anterior segment and then the posterior segment, we should have ambient time, that is tissue contact time should be more in the eye, so that we will be having the bioavailability. And that is why our Tarpana and Purpaga is more important in this Kriya Kalpas, so that the medicine will go into the posterior segment. after going through all the barriers. Drug delivery system is also very important. As I told, we are having a precorneal area. We are instilling the medicine. It can be an Aschodana, it can be a Seka. So many things are there, and we are applying medicines like Pinti Vidalaga. We are having Tarpana Pudupaka, and also we are having Anjana. Okay, all these medicines should act according to this route, drug route, yeah, drug delivery route. So again, cornea ko par karke jo aqueous humor mein jayega, it will be having the contact with the ciliary body, and there we are having the aqueous barrier, blood aqueous barrier is there. And if it is going beyond to vitreous chamber, we are having blood retinal barrier there. So ये सब पार करके अगर medicine act करना है, it is a very tough thing, and that's how we are tackling these drug delivery routes. In modern, what they will do, topical medicines will not be giving that result, because there are so many things like nasolacrimal duct wala drainage due to blinking, etc. So many this outward movement of the drug will be there. So it will not be going into the interior of the eye. So here the importance of Kriya Kalpa comes. Okay. And regarding the modern aspect, as I have told earlier, we are having a traditional system, that is anterior target and a posterior target, that I have explained. And new drug development system, what they will do, they will be having the penetration enhancers, ocular bioadhesives, nanotechnologies, occusers, etc. See, this occusers concept was also there in the previous time. We are having three forms of morphologically we are having the three forms of Anjana, Pinda, Rasakriya and Churna. So if the Pinda we are applying or we are keeping in the lower fornix sac, it can have this action of occusers also. It should not be inserted inside the conjunctiva, even if we are keeping it, and slow drug delivery will happen. So again, tissue contact time is more, bioavailability is more. That's what we are needed. We are in need of this bioavailability and increased absorption. Then regarding the traditional system, topical route that I have told, transcorneal and non-corneal route. And parenteral route, what is parenteral route? We are having so many injections. Okay, subconjunctival hota hai, intravitreal injections, retrobulbar, peribulbar, etc., etc. And transcorneal route, transcellular pathway and paracellular pathway. Here, Tarpana and Pudupaka is very important. See, in Tarpana, we will be using almost all the snehas, Sarpi, Majja, Vasa, except Taila, we are using all the other snehas. Taila is contraindicated in the eye. So it is not admissible if we are using Taila for Tarpana. Okay, and paracellular pathway is mainly for hydrophilic drugs, and we know about the Pudupaka Swarasa. So we are having a combination of both lipophilic drug and hydrophilic drug. So it will be going through the corneal route, that is transcorneal route, and it will be giving us the desirable effect. And what about the non-corneal routes? It will be conjunctiva, sclera, and absorption through the bloodstream. What are the bloodstream there in the anterior segment? Obviously, we are having conjunctival vessels and ciliary vessels. And what all factors will be affecting the permeability? There also Acharya is having wonderful observation. See, here it is lipophilicity, molecular weight, degree of ionization. I hope everybody will be remembering the treatment while he was telling about Shushkakshipaka Chikitsa. Okay, he was telling to make it ionized by rubbing in the mirror. So degree of ionization will increase the solubility. Then surfactant action. If the surface tension is reduced, then the absorption will be more. Likewise, the viscosity also. And what about the barriers of absorption? And by Kriya Kalpas, we are also going to tackle these barriers. So, blood ocular barriers are two in number. Blood aqueous barrier and blood retinal barrier. One more barrier is there, that is a mucin barrier at the corneal and conjunctival surface. This mucin barrier, see, you will be knowing about the tear film, and the tear film will be having three layers, and the internal layer will be the mucus layer. Okay, so there is a barrier in this mucin layer also. So everywhere we are having the barrier, and in the cornea, in the epithelium itself, we are having a layer of 5 to 6 cells thickness. Okay, so it will take nearly 1 day to cross one layer of cell. So just imagine अगर हम तर्पण बार बार नहीं किया, if we are not going for तर्पण more than 5 days, और अगर परमिएबिलिटी कम है एंड अगर हमें ज्यादा इंटरनली मेडिसिन posterior सेगमेंट तक मेडिसिन को लेके जाना है, what we have to do, we have to increase the time, or we have to increase the matra for which we are keeping the medicine in the eye. This only will let the medicine go into the eye, crossing the retina, or else it will be waste. And what about the anterior segment? See, physiologically, what all will happen if we are dropping an eye? So, see, if we are using a teardrop, what will happen? It will roll out, obviously. Then, by blinking, it will go through nasolacrimal duct. It will go. And what are the anatomical barriers? See, static barrier is there. I have explained like the corneal epithelium. 5 to 6 layers are there. And regarding the stroma, blood aqueous barrier. And what about the dynamic barriers? Conjunctival, blood and lymph flow, then tear drainage. See, if the medicine is not having this bioavailability due to decreased tissue contact time, whatever medicine we are instilling, whether it is Amrit or not, it will not work properly. See, the main thing is in Kriya Kalpa, we have to think about the two terms. That is more important. That is increased tissue contact time, so that we will be having more bioavailability of the drug. That is the main aim of our Kriya Kalpas. Okay. And what about the posterior segment barriers? We are having again static barriers. My God. Yes, we are having sclera, Brooks membrane. Everybody will be remembering the anatomy of the eye and all, retinal pigmented epithelium, endothelium, etc. And again, we are having the blood retinal barrier. This is also a very complicated thing. See, in modern medicine, only one way is there if they want to take the medicine to the retina. That is only through the systemic supply. Okay, once it is going through the ophthalmic carotid artery, gaya, then ophthalmic artery, then retinal artery. And there also we are having retinal barrier. Then how the medicine will act? And here we are having the excellent work by Tarpan and Pudupaga, which is the medicine in which the medicines will be going directly to the posterior segment. Okay. Then the dynamic barrier, drug clearance and mechanism. See, drug clearance. What about the drug clearance? We are having this drug clearance by the posterior system and anterior system. In the posterior system, the drug clearance will be done by the blood retinal barrier, and in anteriorly it will be aqueous drainage bhi hota hai, and we are having blood aqueous barrier also. Okay. And regarding this excretion of medicine, we are having reflex lacrimation, nasolacrimal duct wastage, blinking, aqueous outflow, venous route, and from anterior chamber via angle of anterior chamber and to the uveal blood flow. Then what will happen? It will go to the choroidal circulation, then vortex vein, again it will be going into the, iska last target kidhar hota hai, it will be going to the cavernous sinus. Okay, from vitreous via anterior and posterior route. Then, kab dena hai ye? Again, this is a question. See, Kriya Kalpa can be done beautifully by a therapist, and the medicine can be prepared in a very well manner by an internee or a student. So, karna alag hai and kab karna alag hai. If you are not judicial enough to tell when to do, then पूरा जो procedure है वो गड़बड़ हो जाएगा. So again, we should know about the Kshanadi and Vyadhyavastha and whole the Vyadhi Gadagas. Okay. So time of Kriya Kalpa, administration, etc. should be according to the diurnal variation, seasonal, etc. And selection of Kriya Kalpas according to Vyadhyavastha. It is also very important. In Samavastha, we have Seka, Ashotana, Pindi and Vidalaka. Okay. And extras, that is Avagundana, that is Brahmana, जो मैंने बोला गुंडना भी बोलते हैं, चक्रदत्त वाला जो ऐसा भी बोला है, अवचूर्णना, मोती एक्सेट्रा. And in Niramavastha, we are having Anchana, Tarpana, Pudupaga. Okay. Sweda Pralepatiktanam Seko Dinachadushtayam Langhanascha Akshiroganam Amanam Pachana Nishat. See, Pachana is very important for Akshiroga also. If we are not judicially applying this concept while doing Kriya Kalpa, the whole Kriya Kalpa will go waste. That is towards this practical thing. करना तो आपका थेरेपिस्ट कर लेगा ना, but when to do वो आपका काम है. Okay, so we should be judicially, जैसे मैंने पहले बोला, दूष्यम देशम बलम कालम, everything should be considered. And which procedure? Again, according to the condition. Which drug? I'm not going into this drug and all, and what textual hai, we'll be discussing the practical things. And in which form? That also should be according to Nidana Panchaka. Okay. And Acharya ने तो बोला है specially निदान परिवर्जनम एव चिकित्सा, कौन सा निदान है करके we have to consider, and accordingly ही हमें procedure करना पड़ेगा. क्रिया कालास, okay, and according to dosha, according to dhatu. See Anjana examples, so many examples are there. In Shukla Gada Roga, Anjana will be different. In Krishna Gada Roga, Anjana will be different. Gharshana Anjana will be there. Lekhan Anjana will be there. Prasadan Anjana, Pinda Anjana, Rasakriya, Churna, Sandhava Anjana. So many Anjanas are there. So, Anjan mein see, if we are deciding for Anjana, तो कौन सा drug use करना है is also mandatory. We have to think over that also. It is not like एक ही अंजन रखा फार्मेसी में, सब लोगों को वो दिया. It will not work. These are the pictures, and you will be having good videos after this session. So I'm not into that. And now we'll be discussing about Seka. Okay, what is Seka? It is Sekastu Sukshmadharabihi sarvasmin nayane hitaha Meelidakshasya martyasya pradeyaha chaturangulat. Okay, and what is Seka? It is Dharati Rupa Sweta. As per Adamala, it is clearly explained. And what about the height? Acharya ने तो बोला है कि okay, 4 अंगुल से ऊपर से करना है. But again, we are having a term like Sugod Seda. That is the yukti of our practitioner. See, if it is Kabha, then the height can be increased. That is our yukti. If it is Pitta, जो 4 अंगुला है, उसमें से भी patient को तकलीफ होगा. So we have to reduce. And regarding this types and all, matra and all, I am not into that. And one more thing, while we are considering the matra, what is matra is also very important. There are so many definitions of matra. Yavat paryeti hastagram, dakshinam janu mandalam. See, so many examples like lagu charana matra, guru akshara ucharana matra, angulyo chodika. So many things are there. So we need a standardization for this matra. So practically, अगर हम बोलेंगे, we should be having the time. And time भी काफी नहीं होगा. We should be balancing it with the amount of drug. So in a Neti can, if we are doing for this, if we are going for this Seka, we will be taking 5 minutes. And as per the Shanadi classification, 100 matra will be equal to 2.5 minutes. And practically in Kerala, we used to take it as 2 minutes. And if we are going for this Angulyo Chodika, Unnesha Nimeshana, etc., it will be between 45 seconds and 55 seconds. We did a trial for that. So we got the time as between 45 seconds and 55 seconds. See, it is below 1 minute. So, okay, in a standardized way, we can use it as, or we can fix it as 2 minutes or 2.5 minutes. And one more thing is, if we are going for Seka, see, Seka medicine aapne kar liya, correct disease we dekh liya, and if we are not doing in a particular or correct time, if we are not knowing about this diurnal law, about this Seka, then again it will not be working properly for your patient. So it is not indicated to do Seka at the night. Okay, in Atyayika condition you can go for, or else you should be doing only in the first yama of night, or else you should do in the daytime only. Okay. Then mode of action. Mode of action to abhi humne pehle discuss kiya hai. That is regarding the tissue contact time, absorption, bioavailability, reflex lacrimation is less. How we are doing Seka in Meelidakshasya martyasya. So if we are pouring the drug directly, it will increase the tear meniscus and it will roll out immediately. But if we are doing it in a closed eye, the tear meniscus will be less in height and it will not be flowing out immediately. So that NLD drainage will be less, loss by evaporation is less. You are closing the eye and you are going for Seka, right? Okay. There are some conditions in which we will be going for open eye also. See, if there is sloughing, So starting में we will be doing open eye, matlab in order to wash it out, and then we'll be doing the proper seka. And what about the types of seka? We are having normal seka, and that is patra dwarena and potala dwarena. So these two seka should be considered. There is a disturbance of sound.
Ma'am, have you joined with 2 devices?
No.
Make the one speaker off, ma'am. Then it will not echo. Yes. Now okay, ma'am.
Okay. So, and in Seka, we are having controlled drug release. Unless Ashyotana, we are having a controlled drug release in Seka. And the procedure time is also more. And what about the compliance? Compliance term should be understood while doing Kriya Kalpa. The concentration of the medicine should be enough so that the absorption also should be great in a particular disease. That should be considered by the word compliance. And regarding this Patra Dwarena Seka and Potala Dwarena Seka, we are having the term called Muti. Okay, in Muti, what you will be doing, you will be having the potali and it will be having the Sladhana Bandha. Okay, it will not be tightly tied and it will be Shithila, and then you will be dipping that particular medicated potali into this particular Drava Dravya. It can be milk, it can be mastu, or whatever drug you want. It can be Tribala, Kashaya, and then you will be squeezing that into your Akshi for doing this Seka. And in Kerala, we also practice, we'll be using the leaf and it will be formatted into the shape of a corn, and we'll be keeping one varti over that, and then uske upar hum medicine dal dete hain. Okay. So in that way also, there are so many practical differences while we are doing this Seka. It is not only the textual Seka that we are studying. So many things are there, and that is according to the Yukti. And so many vessels can be there. Koi glass se karega, koi neti pot se karega, koi in Kerala we are having an instrument called Kindi, usse karega. So many things are there. Okay. And regarding Ashyotana, see, Ashyotana is regarded as the first Kriya Kalpa by Vagbada. Sarvesham Akshiroganam Adau Ashyotanam Hidam. But as per Charagad Adi Upakrama is different. It is Bidalaka. And what is the difference? Main difference, it is done in Unnilitakshi. And why Unnilitakshi? And see the site of application of the Ashyotana. It is in Drik Madhya or Kanina Sandhi. Why in Drik Madhya? It is explained by Sharangadhara. And you will be knowing about the ciliary vessels. Anterior ciliary vessels are there near the limbal region. So the Drik Madhya, by telling this Drik Madhya, Acharya may be telling about the limbal region. So if there is any ciliary congestion, see, agar congestion hota hai to the medicine, the permeability of the medicine or the absorption rate will be more. So as per Sharangadhara, see, this also should be done judiciously by the physician. If you are having uveitis or posteriorly, dikkat hai aapko. If you are having anterior uveitis, iritis, iridocyclitis, cyclitis, intermediate uveitis, etc., 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 you should go for Drik Madhya Ashyotana. But if it is, if the condition is of conjunctival or it is conjunctival congestion or conjunctivitis, then you should go for Kanina Sandhi. In Kanina Sandhi, the goblet cells are also more. Absorption will be more in Kanina Sandhi. That's why Acharya is telling, that Vagbada is telling about Kanina Sandhi. And height is 2 angula. And it is explained in Na Adi Prabala Roga. So Prabala Rog mein kya karna hai? We have to go for Seka. And it should be done in Purva Rupavastha. Rupavastha mein we can go for Seka. Okay. And done in Bindus. Again, Bindu ka classification bhi, it is a little bit confusing. अगर प्रदेशिनी अंगुली पर्वतद्वयात् मग्न समुद्रदात् यावत् पतति असौ बिंदु वाला हम कोटेशन लेते हैं. According to Aruna Datta, he is telling जो first बूंद है उसको बिंदु बोलना है. And as per Susruta, he is telling as Matra, Shukti, Pani Shukti, etc. So from one dipping, we may be getting 3 drops. The first drop can be considered as bindu. Okay. And it should be done in the daytime always. Why? In the night time, before sleeping, in the night, what will happen? Your this iris will be, pupil will be dilated. If the pupil is dilated, what will happen? The muscles will be clogged into the region of the angle of anterior chamber. It will cause problem. And in the night, what will happen? It will be constricted. Again, night wala time में it will go. But हमें जो controlled drug release है, वो as per the condition we will not be getting. So that may be the reason that Acharya is contraindicating Aschodhana in the night. In one of the tika had read like Bidalaga also should not be done in the night. Okay. Again, I'm not going into those types, drops and all. Again, the mode of action, tissue contact time is less. What will happen here? Drainage, it will outroll. Then nasolacrimal duct drainage will be more. See, while we are applying the Aschodhana drugs, it will go almost directly into the systemic circulation. And systemic circulation में अगर drug जाएगा तो वो घूम फिर के हमें action देने के लिए भी थोड़ा time तो लगेगा. Okay, I'm accepting कि जो भी हमारा venous drainage है, by that it will be going to our cavernous sinus. And again, you have to think about this nasya action also, Srota Srinkadagam Prapya. It is the joining point of almost all the sense organs. है ना? And nasya का जो फलश्रुति है, that is applicable here also in almost all the kriya kalpas. है ना? Khana unnata prasannatva skanda grivasya vakshasaha dridendriya. See the term dridendriyastu apalita bhaveyuhu nasya shilinaha. So this Aschodhana can be used in diagnostic purpose also. It is not only a treatment procedure, it can be used as a diagnostic procedure also. We should work on that also. Okay. Then again, absorption will be less, bioavailability also is less. And वैसा मैंने बोला, reflex lacrimation, blinking and NLD drainage से medicine will be going out without absorption. Loss by evaporation more, lacks controlled release of drug. In SECA, we are having that control. And usually in modern medicine, if they are telling about the eye drop, what they will tell, अगर आपको 2 बूंद डालनी है, तो 1 बूंद और second बूंद के बीच में 5 minutes का gap रखने के लिए बोला है. And now in this Aschodhana, we are having 7, 8, 10 drops. Continuously हम डाल रहे हैं. So obviously it will be going out. And here the system absorption is more than the other internal absorption. जैसा हम तर्पण और पुटपाक में बोला, it will not be here. And rubber drops from Anguli is terms, okay, we have discussed. And what about the Pindika? See, while we are doing this Pindika and Vidalaka, we should have the procedure, we should have in our mind the procedure Mukha Lepa. Okay. In Ashtanga Sutrasthana, we have studied in the first year Mukha Lepa Shilanam Dridham Bhavadi Darshanam. So we are having subcutaneous absorption, we are having nerve stimulation, so many things are happening while we are applying some medicines in the face also. So what will be the result if we are doing that same application in the eye? So in Pindika and Kabalika, we'll be having the desired effect if Mukha Lepa is also giving Dridha Darshana. Obviously, it will be giving. Then it will be, the Kalka will be bandaged in Vastrapatta. See, if we are making a dip in the center of that Kabalika and we are approximating that Kabalika or Pindika or Kabalika into the eye, then the approximation will be more and the absorption rate will be more. And why we are bandaging it with Vastrapatta, and before bandaging it with Vastrapatta, usually practically what we will do, we will be covering it with gauze in order to prevent the particles going into the eye. Okay, all these things we have to consider, and it can be used in Rana, Abhishanda, etc. See, the Pindika is having tremendous effect in the Vadmakata Roga, in adnexial disorders or in the anterior segment disorders, especially. This Pindika is having tremendous action. Recently, we were having a case of Slishtavatma. Okay, and it was not responding with anything, and the Pindika with Grida and see Durva Grida and honey was giving tremendous action in that case. Okay, so it can be done in Snigdoshna or Sukoshna form. And जैसे हमने बोला, the varieties of Pindi includes Avagundana, Gundana and Brahmana. This Gundana and Brahmana terms are explained in Chakradatta, And Avagundana, it is explained in Ashtangrade Uttaratantra. In Kerala, we are having a term called Tari or Takari. The same, the method is almost same. What we will do in this, we'll be having small पोटलीज. जैसे हम पिंड स्वेद करते हैं वैसा हम छोटा छोटा this ballers बना के will be having small portalies, and with portali we will be doing swedana. So in Pintika we are tying the medicine, but in Avagundana we are applying it continuously. Okay, or we are mopping, or we are wiping, or we are applying it continuously. Brahmana, so Brahman hai to we will be moving it in a circular manner. And Gundana and Avagundana, again, this can be done in dry and wet form. According to the condition, it can be done in dry and wet form. So that is according to, again, you have to think about Dushyam, Desham, Balam, Kalam. See, the basic principles are same for every Kriya Kalpas. It is not like, isme ye Kriya Kalp karo, ye drug use karo. It will differ person to person, season to season, according to dosha predominant. So it is not mandatory or it is not applicable. अगर आपसे किसी ने पूछा कि diabetic retinopathy में आप क्या करोगे, it will differ according to the patient. It will differ according to the condition. So it is not possible to tell this pindi is for that or Kabalika is for that. Okay. So again, everywhere in Kriya Kalpa we should think of this Dusham, Desham, etc. Then Vidalaka. And as per Charaka, it should be done in Utpanna Matra Tarunakshi Roka. As per Vagbada, what we were doing, it is Ashyotana. Sarvasham Akshirokanam Adav Ashyotanam Hidam. And what is the peculiarity of Vidalaka? It is Vidalako Bahirlepo Netre Pakshma Vivarjitaha. It should be applied except this Pakshma area. Okay. See, agar Mukhalepa is giving tremendous result, Vidalaka and Pindi will be giving you tremendous result. Okay. And what about the thickness and all? That is Doshahara, Vishahara, Varnahara, 1/4, 1/3 and half. Okay. Again, the mode of action of Pindi and Vidalaka helps in vasodilation, hence relieves inflammation, congestion and irritation. In cellulitis and all, you will be having tremendous effect. Okay. Increases the temperature, thus drainage of toxins from the site of lesion is faster. See, while we are doing or we are discussing the pathology of Akshirogas, we should not discuss the pathology without telling the term Abhishyanta or without telling the Rasa Rakta Dushti. Generally, and see, we are having autoimmune disorders also. See, so many autoimmune disorders will be joined to the Akshiroga also. You just see the relation. Vidahyanam viruddham cha tattacha asad pradushanam bhajadam vidihinam cha supna jagara maidhunam, etc., etc., etc. That is the nidana of Raktavata. And what about the nidana of Raktavaha Sroto Dushti? Vidahini annapanani snigdoshnani dravani cha Raktavahini dushyandi bhajadam cha atapanalo. We are having a common factor. Once asked, one of my guru, Prasad sir told, he told the sentence in a funny way, but it is the apt explanation for Abhishyanta. It is the jagda between Pitta and Kabha in the platform of Rakta. It is like the jagda between husband and wife in a house. The house is Rakta, husband and wife should be Pitta and Kabha. Okay, so if there is any increase in the Pitta, you will be having problem with Kabha or vice versa. And you should remember always the sentence. Chakshus tejomayam tasya visheshat sleshmato bhayam. See, agar thoda sa bhi sleshma ka vriddhi ho gaya to gaya, aankh gaya. That is why we should apply tarpana judiciously. Agar thoda bhi wo zyada ho gaya, you will be having negative results. So आपका patient भी बोलेगा तर्पण किया तो मुझे कुछ फायदा नहीं हुआ. क्यों नहीं हुआ? Because you are not knowing when to stop the tarpana. You are not assessing the samavastha, niramavastha. So that these are the practical difficulties or practical things that we have to consider while doing the Kriya Kalpas. Okay. Then the mechanical effect in reducing IOP by dilatation of vessels, etc. And this I have already explained, like Mukhalepa. Then Anjana. Again, definitions and all sordo. And what is the importance of Anjana? Anjana will act in the anterior segment also and most probably in the posterior segment also. And the thing that you have to consider while doing Anjana, Tarpana and Pudpaka is अगर आपको ये तीनों करना है, the patient should be nasya arha and it should not be done in nasya anarha. Tarpanam cha kudapagam cha nasya anarhe nashilaye. If you are not going for proper cleansing by nasya, you are not going to do this anjana, tarpana or kudapaga because it will not work properly or it will not go the posterior target. You will not be getting the correct effect. If you are preparing this kanapipalya, the anjana in Naktandya, you prepared very well and you have applied the anjana, but still the patient is not having the effect. Why? The thing is, आपको पहले cleansing करना है. शिरस, see, देह शुद्धि, शिरस शुद्धि. उसके बाद ही आपको अंजन करना है या तर्पण करना है या कुड़पा करना है. Otherwise, it will not act properly. And I'm not going into this types and all. And regarding this morphological classification, we are having Pinda, Rasakriya and Churna. And Pinda is the most strong form. मैंने पहले बोला था कि we are considering the accuser in the new generation mode of application. So Acharya has told this in the previous time itself. And Rasakriya, see, if we are having Pitta Rakta involvement, we should go for Rasakriyas mainly. Okay.
और 1080 रुपए ब्लड टेस्ट.
Then regarding this matra and all, then we should go for pradhana karma, paschat karma. See, the way of doing this anjana, that is mainly theoretical. The main thing is kab karna hai, kya select karna hai, that mainly matters. Okay. And see, we are having some of the special anjanas explained. Pratyanjana. What is Pratyanjana? It should be done after Tikshnanjana. That is a Churnanjana. Then Lekhananjana. Okay. Raga, Shru, Vedana, Shantau, Param, Lekhanamanjanam. And what is Sandhavanjana? Is there any Anjana that can be done in Raga, Ashru, Vedana condition? Okay. It can be done with Sandhavanjana. And we are having Pindanjana, which is explained in Linganasha Pratisheda. Rupananjana it is. Rasakriya in Pittarakta Prasadana conditions. Yoga Anjana, it is explained especially by Susruta in Praklinnavatma. Then Snehanjana. So many Anjanas are there. Okay. All these things are textual. You should go and read. I'm not going to explain all these. Okay. Then mode of action. Again, drug entry by conventional route. Reach both anterior and posterior target. See, मैंने बोला कि नस्य अनर्ह है तो आपको अंजन नहीं करना है. But in some conditions, in नस्य अनर्ह also you can do anjana. In which condition we can do anjana? If you are having a condition which is completely external, anterior segment vatmaja hai, and you need pratisarana, so you can go for tikshnanjana. It will drain the fluid or drain the toxins from there. Okay. So in that condition, it is Atyaiga condition. So in Atyaiga condition like Visha, etc. With Vilwadi Gutika, we will be going for Anjana. Okay. So in that condition, you will not be getting time for the proper Shuddhi. So at that time in the anterior segment or in the anterior adnexa or Vatma, etc., you have to go for Anjana without proper Shuddhi also. But if your target is posterior, if it is the posterior target, if you are doing Anjana without proper Shuddhi, so it will not work properly. Okay. Then drug absorption by the ocular tissues, drug elimination by the anterior and posterior route that I have told. Anterior route, which is the anterior route, that is blood aqueous barrier, aqueous drainage system, and posterior route, that is by blood retinal barrier. Then systemic absorption occurs resulting in systemic action. Anjana acts on Netravatma, Shira, Netra Kosha, Srotas, Rinkadaga Marma that we were explaining. Then regarding Tarpana. Again, see, while doing Tarpana, we are having the drugs, all the snehas except Taila. Okay. We can use Vasa, Mamsa, Majja, Sarpi, Majja, Vasa, Tail ko chhod ke baki sab kuch. And where it is explained, it is in Vata Paitika condition. I hope you will be remembering the quotation that we have studied in the first lesson, Chikitsa, Jwara Chikitsa. जब हमें ज्वर चिकित्सा सिखाते थे तो टीचर्स वर टेलिंग ज्वर चिकित्सा पढ़ा है तो पूरा आप ट्रीट कर सकते हैं, है ना? And if you are having the concept of dosha and if you are having ज्वर चिकित्सा with you, you can treat anything. अगर नाम नहीं पता तो भी प्रॉब्लम नहीं है करके बताते थे, है ना? इन वाइवास एंड ऑल वी वर स्टडीइंग दैट श्लोका बचने के लिए। विकाराणाम कुशलो न जिग्रियात् कदाचन न हि सर्वरोगाणां नाम तो अस्ति ध्रुवास्ति। That was the escaping factor for us. And what about this vata pitta condition? Sarpir dadya kabhe mande. See the term. Sarpir dadya kabhe mande vata pittottare jware. See, there it is vata pittottara jwara. But in tarpana, in akshi condition, in vata pittottara condition, we are going to give ghee. And we are not using taila. Okay. And it should be done after Shuddhi of Kaya and Shira. And the method of administration, I am not going into detail. This matra and all, I am skipping. Purva Karma, then. And what about the time? That is also very important. See, we are having Vatmam Santim Sitam Krishnam Drishtim Va Sarvamakshim Va Rogan Kuryuhu. है ना? सर्वरोग निदानोक्ते रहिदेहि कुपितामलाः अचक्षुष्ये विशेषेण प्रायः पित्तानुसारिणः सिराभिरूर्ध्वं प्रसृता नेत्र अवयवमाश्रिताः वत्मं संधिं सितं कृष्णं दृष्टिं वा सर्वमक्षिं वा रोगान् कुर्युः। उसके बाद आचार्य ने बोला है while doing tarpana you should increase the matra kala of the tarpana drug. In one condition it will be 100 matra. In another condition it should be 300 matra. In another पीछे पीछे जाते हैं तो आपका टाइम ज्यादा करना है. It should be 100 matra, 300 matra, 500 matra, then 700 matra, 800 matra, 1000 matra, etc. It should not be static. आपने एक 100 मात्रा में फिक्स किया या 1000 मात्रा में फिक्स किया. It should not be done like that. As I have told earlier, if your see hृदय is lipophilic है ना, and cornea is corneal epithelium is lipophilic. And ये जो घी आप डालेंगे दर्पण के लिए it will be penetrating through each and every layer. उसका मैंने बोला एटलीस्ट 1 day तो लेगा एक लेयर को पार करने के लिए. एंड जब आपका टिश्यू कांटेक्ट टाइम ज्यादा होगा it will be penetrating into the posterior segment. So if your disease is in the posterior segment or if your target is posterior, then the matra of administration should be more. एक दिन में 2 दिन में तर्पण करके छोड़ने से कुछ नहीं होने वाला. And then आपको blame नहीं करना है तर्पण के ऊपर. Okay, that is knowledge that you are going for tarpana for.
Hello, Dr. Praveena ma'am. Hello. Hello, ma'am, you are not audible.
Okay. Then Malati, Mallika, Pushpa, uska bandhana. See, we should always have the concept of Chakshu Vaisheshika Alochaka Pitta and Buddhi Vaisheshika Alochaka Pitta in our mind while you are treating the Akshiroga. It is not, I should not be considered as a mere anatomical structure which is in the orbital cavity. You may be having cortical blindness also. In the previous class, we were having a discussion. Hai na? See, you are having Chakshu Vaisheshika Alochaka Pitta and Buddhi Vaisheshika Alochaka Pitta. And these, both of these should be working synchronously, otherwise it will not act properly. Aapko dikhai nahi dega. And Drishti is also having structural and functional entity. It is not, and Shirastalvandaragadam Sarvendriya Param Manaha. We can't correlate like brain is equal to mind, heart is equal to mind. ऐसे हमें correlate भी नहीं करना है. Okay. Then again, how to do this? कितना लेना चाहिए? See, 250 gram तो it is more. 200 gram से भी हो जाता है. 50 ml में तो ज्यादा डाल के रखा है. 30 ml से अगर आप करके करके अच्छे से आप कर रहे हैं तो 30 ml से आपका अच्छे से तर्पण हो जाएगा. 250 ग्राम का फ्लोर भी नहीं चाहिए. 200-150 ग्राम से आपका अच्छे से तर्पण हो जाएगा. ओके. देन मोड ऑफ एक्शन सेम जो हमने पहले बोला है. कॉर्नियल लिपोफिलिसिटी इज मेड यूज मेनली corneal epithelium, that is stratified squamous epithelium of 5 to 6 layers. And घी अगर टर्नओवर करना है तो मिनिमम 1 दिन होता है एक लेयर को पार करने के लिए. ओके. And tissue contact time is also more and bioavailability is also more here. And regarding this Pudapaka, and while considering Pudapaka, again you have to think of the general sentence or general sloka that you have studied in Sneha Sweda before doing this Virechana or Vamana, whatever it is. Sneha Klinna Koshtaga Dhadukava Srotolina Yecha Shakha Asti Samstha Sweda iste Dravikritya Koshtam Nitva Samyak Shuddhipir Nirharante. That is explained while Acharya was explaining about the Virechana or Kaya Shuddhi. The same is applicable in Akshi also. In one sense, Pudapaka can be explained or considered as the Virechana of the drug after the Snehapana, and Snehapana is nothing other than Tarpana. So, if you are doing Pudapaka, it should not be done for half an hour, 1 hour like that. It should not be a protocol. आधा घंटा किया, 1 घंटा किया. आचार्य ने clearly बोला है, it should be for 100 matra or 200 matra or 300 matra. So you should be judiciously applying this Pudapaka also. Pudapaka ज्यादा किया तो क्या होगा? जो श्रावण करना है, जो एक्सेस कब है, वो तो निकालेगा. And आपका जो स्रोतस है, उसका clarity या उसका शुद्धि तो करेगा. But if it is kept for a longer period, what will happen? वादवृत्ति will happen. तो जो भी आपने तर्पण करके आंख को अच्छा करके रखा है, वाद पित्त कंडीशन में जो आपने तर्पण किया है, अगर पुड़पाक ज्यादा किया तो पूरा इफेक्ट गया. एंड सी जो स्रोतस का बेसिक क्वालिटीज है, अधिप्रवृत्ति संगोवा सिराणाम ग्रंथोपिवा विमार्गो वा गमनम. एंड अगर पुड़पाक ज्यादा करेगा तो ये जो स्रोतस है वो पूरा बिगड़ जाएगा. सो हमें डिजायर्ड इफेक्ट तो नहीं मिलेगा. So this also we have to consider. Then again this procedure and all I am not going into detail. Mode of action, again both hydrophilic. See this Pudapaka drug we are preparing with mamsa and medicines. So we are having a combination of hydrophilic and lipophilic property of drugs. And see our cornea, मैंने पहले बोला कि corneal epithelium is lipophilic but stroma is hydrophilic. And जैसे कि हमारा मास, अगर मेडिसिन का मास ज्यादा होता है तो मिनिमम परमिएबिलिटी कॉर्निया से होता है 5000 डाल्टन. ओके, उसके बाद 20,000 50,000 20 टाइम्स या 4 टाइम्स या 10 टाइम्स करके परमिएबिलिटी ज्यादा होता है कॉर्निया एंड कंजंक्टिवा में, सॉरी कंजंक्टिवा एंड स्क्लेरा में. बट दैट फास्टर एब्जॉर्प्शन विल नॉट बी देयर इन कॉर्निया. वो धीरे धीरे ही अंदर जाएगा. So we should be judicial in this area also. That is why we are making it light by doing Pudapaka. हम directly स्वरस तो डाल सकते थे. Pudapaka का 2 विधि बोला है, one is तर्पण जैसा, one is अश्चोदन जैसा. 2 विधि आडमल ने या गुडार्थ दीपिका में तो वैसे बोला है ना. We can be we can use Pudapaka in 2 forms, like Tarpana or like Ashodana. But here after Tarpana we are not using the Pudapaka like Ashodana. Why? और पुड़पाका, सी पुड़पाका रसा ही हम यूज करते हैं. Why? Because it is becoming lighter and in some conditions we can go for Ashodana type Pudapaka rasa also. That is also according to the yukti. And one of my sir told, see in older period they were doing Tarpana continuous and they were not doing Pudapaka in very very rare cases. And as I have told, or as Ramakrishna sir told, I was having my Shishyaship under Viduri Bhavadasan sir, and they are doing tremendous work in Akshirogas. Okay. Then other procedures that I have already explained, Avagundana, Avachurnana, and Muti. Then the discussion portion, again we have discussed all these earlier. Kriyakalpa's mode of absorption depends on the factors like route of administration, precorneal fluid drainage, instilled volume, viscosity, pH value of the drug, tonicity, drug binding to tear protein. See, अगर drug ज्यादा जाके tear protein पे bind हो गया, तो bioavailability गया ना, वो tear protein पे ही अटकते रहेंगे. So we are not getting the potency of the medicine. Then systemic drug absorption, corneal factors, melanin में जाके अगर bind हो गया, again we are not getting the bioavailability. Then drug metabolism also. Then conclusion, Kriyakalpas when administered judicially are capable of curing the ocular pathology. See, you should always remember the term judicially. आपका therapist करेगा every procedure, आपसे भी अच्छा करेंगे, and medicine का बनाना आपका intern ही करेंगे. But कब, कैसे, क्या, किस medicine से करना है, that is up to you. वहां अगर आपने गलती किया तो आपको desired effect नहीं मिलेगा. Then these procedures are making use of mechanism of ocular pharmacokinetics from the ancient period itself, thus increasing the tissue contact time, bioavailability, and the rate of absorption. See, tissue contact time and bioavailability is directly proportional to the rate of absorption. Then the practical implementation of every technical term in ocular pharmacokinetics and ocular drug delivery system is made use in Kriya Kalpas so as to give better results both in anterior and posterior targets. So these Kriya Kalpas should be done judiciously. And here is my favorite slogan, and this is the end slide. Nattam dinani me yandi kadham bhudasya samprati dukkha bhak na bhavatyevam sada sannihita smriti. You should be your better version every day. Every night you should be revising your version so that in the next day you will be a better version of you. From the first year itself, this is my favorite sloka, and this sloka is from Ashtanga Hridaya Dinacharya. And मेरा आप सब लोगों से निवेदन है कि ये जो श्लोक में जो मैटर है वो आप भी हमेशा कर लीजिए, so that all of you will be a better version of you in every day or every time. Okay, thank you very much.
Yes, thank you very much, ma'am, for wonderfully explaining various Netra Kriya Kalpas and practical approach, and also covering various aspects which have to be looked after during the Kriya Kalpa procedures. Thank you, ma'am, for a very knowledgeable session. Now, due to shortage of time, we will take the question at last. So I would like to request our next expert, Professor Dr. Sarveshwar Karsar, who is a professor at Shalakya Department and principal of JSS Ayurved Medical College, Mysore. Please proceed, sir. Sir will be sharing a video on 7 Kriya Kalpas with standard protocol. How it should be done, that will be elaborated. I request sir to please share the video.
Yes, you could able to see, madam.
Yes, sir.
Hello.
Sir, please share the video.
You could able to see, madam.
Yes, sir. Yes, sir. It's visible, sir.
It's visible.
Yeah. All are requested to please switch off their cameras for a
Madam, I'll take the question in the latter only.
Yes, sir.
I'll take the question in the latter. Let us watch the video.
Yes, sir. Yes, sir. Sure.
Video is visible.
No, sir. Just share it again.
Yes, sir, it is visible.
Okay. Make it full volume, sir.
Madhusudan Karire.
Hello.
Yes, madam.
Yes, sir.
We are connecting.
Sir, video is not audible.
Now you could able to see, madam.
No, sir. Have you selected entire screen? Then click on the video.
Yes, we have
now
selected the entire screen. It's coming now.
Yes, sir. Yes. Yes. Now visible.
ಇದಲ್ವಾ ಸ್ಕ್ರೀನ್ ಮುಂದೆ ತೋರಿಸ್ಲಪ್ಪ ಇಲ್ಲ ತುಂಬಾ ಮುಂದೆ ಬಂದಿದ್ದಾರೆ ಕೂತ್ಕೊಳ್ಳಿ madam, it is visible.
Yes, video is visible, sir, but not audible properly. Make it
No,
full.
nothing is there to. My voice is clear.
Yes, sir. Yes, sir.
Okay.
Yeah.
We are not explaining anything during the video.
Okay, sure, sir.
I'll be making little takeover. This is prepared in 2006, madam.
Okay, sir.
All esteemed delegates, please watch the video. We'll explain in the latter. This is Shaker. You can have innovations. You can go for Shaker with the PS study. You can take the decoction depend upon the condition of the eyes. It may be Vata predominant or Pitta predominant or Kapha predominant. Accordingly, you can choose the pH of the preparation. See, we can, it's a continuous flow, which you are looking for the definition by Susudhas. So, the Matra colors is already decided 200, 400, and 600. Ropone is the highest, 600. 200 is the least, that is Lekana. So, they depend upon the preparation. Are you looking in the condition too? But eye should be closed. But in practice, sometimes if it is the drug is acceptable, that's not no much irritations, the eye also can be open partially. What you could see in the screen. We do every time we do the PS study, madam. We have already a standardized protocol. If I'm taking Tripola, Justimadu, Lodra, so you have to decide the which drug we are taking, how much quantity you should take, either 3 gram, 4 gram or 5 gram, 50 ml or 100 ml, boiling for 3 to 5 minutes. That's also again decide the pH. This is Ashcheta now. Esteemed delegates, you can see there are placed drugs here, both sides. Sigru, Moringa oleifera, and this side we have kept Kuduchi, Chinospora cordifolia. Again, depending upon the condition, you can choose. And there is a sterile dropper. If the place drug is taken, then that can be used only for a day. If it is taken, or no, what you call drug is not fresh, then it can be used as per the expired date. So in our Kriyakalpa setup, eye practice, institutional practice, we do a lot of place drug preparation, madam. So before putting to the modal pistol, the plant product has to be cleaned properly because it has got, sometimes it has got dust. Also, it has got fungal infections. Therefore, the properly and totally, the plant leaf or stem has to clean in the hot water. And it should be ensured that the plant is properly clean. Then it has to be go for the culture. And from the culture, we can squeeze the fresh juice. Again, we can take jasmine flower, we can take lotus, we can take rose, depend upon the again condition, or maybe durba, cyanodactylon for the Arjuna cases, or Raktabhishyanda. Again now, this is ready. This is ready. This is a sterile bottle, which is again clean in the hot water. Now this can be used as Pravina Madam was talking about, 8 drops, 10 drops, and 12 drops. That can be used depending upon the condition. Yeah, this is again demo only. This is a case of demo. We are putting the canonicus on the nasal canthus, medial canthus, so that it will get enough surface in the eyes. The drops could be flowing out. If you put in the middle or in the temporal canthus, then this is already in a solution format. The medicine is not going to stay much time. The tissue contact time is very minimum here. Therefore, it's always will be put in the nasal canthus. Now, this is one of the most important therapeutical procedures designed by our acharyas 3000 years before. 3000 years before this is designed. Tarpana is the name. Quickly to note down, the preparation of the drug is two way. One is taken decoction in aqueous base. That means tripola quata or jivantyadi quata. We are taking the aqueous base. Then part two, we are taking the ghee. Both is boiled till mrudupaka. When it is mrudupaka, quantum of the water is left out in the ghee. That means the medicine designed for the eye is a suspension of both of lipid and also for the aqueous. And when you look for the cornea, cornea has got trilamellar kinetics. Epithelium lipophilic, stroma hydrophilic, endothelium again lipophilic. So it's a trilamellar kinetics of cornea. So if you're looking for transcorneal absorptions, exactly the scientist of 3000 years before designed the gruta in the suspension base. It's aqueous extract and lipid. That's called gruta. So we can understood how scientifically the tarpana preparation is designed by our Acharya Sushutas to fulfill the criteria of trilamellar dual base of cornea. Therefore, we can expect the tarpana preparation dravyas could able to cross the cornea and can reach to the anterior segment, that is aqueous humor, and beyond. Time is already explained by our previous speaker, madam. So it can be kept for minimum time is 15 minutes to 25 minutes. Again, the hole can be made. After the stipulated time, the medicine can be removed, drain it out. And all delegates, I have a humble submission. We are allowing the drug forcefully to stay for 15 minutes. Shall I repeat? This is a special design procedure where we are allowing the drugs to retain in the orbital foramen, what you are preparing a boundary by the massa pisti, forcefully, willingly. We are keeping the drugs as we require for the condition. Posterior segment, we can keep for, that means dustimanal disease, we can keep for maximum 25 minutes. Yes, after tarpana, there will be a congestion. Therefore, patients should go for dhumopana instead of we are giving steam, which is not very much easy practice for dhumopana. This is anjana. This is the most practiced format of kriyakalpas. The beauty of this, the scientific data of this preparation is, this is in between Sekwaschetana and in middle, in between Puttapaka and Tarpana. If you keep Puttapaka Tarpana on the right side, if you keep Sekwaschetana in the left side, Anjana exactly come in between. How? Because Anjana is a semi-linctus format. If you are doing Bhakti also, finally you should rub it out in the base of honey, milk, ghee, or any other base you are looking for. So this has to be come to the form of again semi-linctus or rasakriya. That may be Babula rasakriya, Yashimudra rasakriya, Darbikata rasakriya, Guruji rasakriya, Durbadi rasakriya. So again rasakriya is a semi-linctus. And it is not a liquid, it is not a Sekar Achetana. It is not, we are not going to keep in the eyes just like Potapaka or Tarpana. But we are going to apply it. Where we are going to apply? It is not on the eyelid margin. It is going to apply on the cool day sac. We have to stretch out the lower eyelid. We should expose the enough area of the lower fornix. In the lower fornix, we are taking this solaka, we are dipping it out. We are smearing the solaka with this, what the paste is prepared right now. You can see in the screen. Stone plate we are rubbing, and that is applied to the cool day sac. And when you leave the, you can see that we have stretched out the lower fornix, exposing, and we are applying. It's not on the eyelid margin, it is on the cool day sac. It's a demo. So when you leave the medicine on the cool day sac, it has got a lot of fold to hold the medicines. Thereby, it is allowing steady state absorption of the medicines. In the second achetana, medicine is flowing out immediately. But in Anjana, the medicine is allowed to stay. But that was the previous one, what I shown, that was the classical one, which it's very difficult to practice at home. Therefore, what I have done is, the innovation is Anjana drops. Take the body, prepare powder in the night, soak in the rose water in the night, then filter through the filter paper in the morning. And after the filtrate, add honey. You have to add honey to make it more viscous. If you are going to make more viscous, it is going to stay much time in the eyes. So this can be used as a drops. That's called Anjana drops. And now it is Pindi. Our previous speaker, Madam, was talking about preparation. You can see there are leaf I have put it because it's mainly used for the analgesic and anti-inflammatory preparations we are having. Therefore, I kept Aranda, Orca, Sigru, depend upon the condition which are analgesic and anti-inflammatory, or you can keep any drug you choose. The drug is cleaned properly. It has now, there are two methods. Madam has already spoken about the Mandana. We have to prepare fine paste. Any base we can add, maybe Gumatra, maybe Godugdha or ghee. This is the second method I am talking about. We have to make it steam. We have to give a steam so that through the pores of the cloth, the medicine is going to release. So the pores of the drug, that's called as the cloth, the drug contained is going to release. This is also practice one type of Pindi. Otherwise, the same medicine can be taken, put in a layer to the cloth and tie over the eyes. That's also called as the Pindi. This is Putapaka. It's another one beautiful format, challenging to prepare, but it has got posture segment activities. You can see there is a mansa meat. You can see this is going to give the lipid base of the drug. Shall I repeat? Mansa is a must in Potapaka, which is going to give the lipid base of the drug, because we require that to fulfill the transcorneal absorption, because cornea has got chylomelain kinase. Lipophilic, hydrophilic, again lipophilic. So you can see this is mixed properly. I have kept Saptavari instead of Jivanyangana. Saptavari is there. Honey is added, Drabha and Dravya. Mansa is properly pasted. All the drugs are mixed properly. A homogeneous Kolka is prepared, paste is prepared. This can be wrapped in the Aranda, Ricinus communis leaf or butter leaf also. This tying is very important properly. I already said Mansa is there. So that is again three types. Ropana variety, Lekana variety and Snehana variety. You can see that we are smearing with Miltani Miti. There are two ways we can do. One is we can put the classical as cow dung, flake, fire. You can see it here. or over the capsule stove. The perfect time you have to remove is you should get crack. This mod will get crack on this. You can see it's also kept in the capsule stove because preparing a bhati in the practice is very difficult nowadays. Brownish color and crack will start. Second method is again through the steam method. Same potoli of putobacco can be kept in the pressure cooker. You can allow to give 3 to 4 whistle, then take it out. Yeah, you can see this. Two you can do. You can do the whistle or you can take out the whistle also. Hello. Yes, madam. Yeah, you can see the crack. Right side is the classical method. Left side is the innovative steam method, where we can easily practice at institutional level. Already I said it. Yeah, you can see the classical method one. The wrapper is open. You can see. Yeah, it's properly burnt, oxidized inside. You can see the meat and drugs all are mixed properly. This require a training to the Kriyakalpas therapist with our proper guidance. Now this is removed. Yeah, it requires a lot of pressure to squeeze because it is oxidized. It has come in the Paco method. We hardly used to get around 10 to 10 ml, maximum 10 ml we used to get. You can see the other steam method. Liquid is coming easily, flowing out easily. You can see the steam method one. Yeah, one is Putapaka classical. Second one is with steam, and this has to kept only for 100 matrakala for lekana, 200 for snehana, 300 for opana. This is bidalaka. We have to leave the eyelid margin because what happens in bidalaka, we are taking a lot of irritant substances, so that it should not touch the eyelid to go to the inside the eye to irritate. This is a pH method I said to you. Esteemed delegates, this is the pH we used to study the pH of every preparation because I could tolerate 6.6 to 7.4. That's the tolerability for conjunctiva. You can see we have tried in different, we have taken the quantity and time. Every preparation should be also checked for the standardization for pH because it will give much acidic pH. I cannot tolerate. Patient will come with conjunctivitis, means red eye next day. This can be done in every institution. It can be practiced. Five gram Kwata Chuna Triphala boiling for 3 minutes with 100 ml is going to give around 4.8 pH. It's getting over. We can. Yeah.
Thank you very much, sir. Yes. Thank you very
Madam,
much.
before that, I take just 1 minute to our esteemed delegates.
Yes, sir.
Anjana Putopakas, see, we have eye is a very specialized organ of the body, Sarvendriya Nayana Pradhanam. It has been protected utmost. We have 3 doses. We have 3 preparations. Bataja Snehana Kriyakalpas, Pitta Ropan Kriyakalpas, and any Kapas condition is Lekhan Kriyakalpas. Again, we have 3 sources of medicines. We have plant source of medicines, animal source of medicines, mineral source of medicines. Esteemed colleagues, our scientists have tried to use all the 3 sources of medicines in the 7 Kriyakalpas. For example, Shekan Ashetana is used. We can take animal product like milk, plant product, but we are not able to take the much mineral product. Therefore, to take mineral product to the use for the eyes, much anjanas is designed. Similarly, when you are going to give the drug forcefully for 10 to 15 minutes in Tarpana, 3 to 5 minutes in Puttapaka. Particularly, again, Puttapaka is designed in 3 format because Tarpana does not have 3 format. Puttapaka has got 3 format: Snehana, Ropana, Lekana. In the Lekana Puttapaka, again, mineral is used: Loha, Tamra, Tutta, Shankha, this etc. 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 Particularly, which you are using in the Anjanas, with our scientific knowledge, we are going to use in the Puttapaka 2, which is going to be kept for 2 to 3 minutes in the eyes. Therefore, it's a lot of scientific evidence the Kriyakalpas is designed, which is going to take out the barrier of blood aqueous and blood retinal. Madam has already spoken about that. The drug is given orally. It is not easily accessible to the eyes. Therefore, Vayu Parimarjan Chikitsa of Charak, what is said in the chapter 3 or 2, then it has come to the that's called internal medication, that is 50 gunas. Exactly same thing also is designed here. Let us try through the locally, topically, through Kriyakalpas and reaching to the retina and beyond. That is the beauty of Kriyakalpas. Over to Madam. Thank you very much for your precious time. I have a salutation to all our Salakis. Over to you.
Yes, thank you very much, sir, for sharing great information on various Kriya Kalpas with standard protocols through audio visuals, and it has really enhanced our knowledge and understanding pertaining to the topic. So we are very much thankful to you, sir, and thank you for being with us. Now we may take brief question and answer session. If anybody is having any question, they can please ask. If you have any doubts or queries, you can please ask by unmuting yourself. Any questions from the viewers or Shishyas? You may raise your hands or you can unmute yourself.
Excuse me.
Yes, sir.
Sir, these Kriya Kalpas are possible in pediatric cases?
Yes. Surely. Because you understood Kriyakalpas are second Ashetana. So Ashetana is nothing but it is instance of the drops. Right from the Kukunaka. There is a disease called Kukunaka. Dear friends, thank you for your question. We know that is a disease called Kukunaka. That is pediatric conjunctivitis, neonatal conjunctivitis, or what you call that is Ashetana is used as a breast milk or something is mixed with the that particularly the Chirosta corifolia. That is Amrutavali Soros is used. Yes, it can be used, but with a lot of care. And we have to see the pH of the drug. It should not be highly irritant.
What I mean to say here, the cooperation of the patient is important. For example, Tarpana, if we want to take up, the child has to cooperate for all this procedure. So see,
no,
for
child means
at least a minute.
yes, I understood, sir. Child means it should be more than 7 years. Yes, the child has to be definitely to grow up. No, I did not say about Tarpana. I have talked about second Ashetana. Tarpana definitely child has to grow. It has to go for 6 to 7 years to cooperate.
Okay, thank you.
Any question, please? If you have any doubts, you can please ask. Any questions from Dr. Praveena Nair ma'am also? You can ask also.
Sir, is it mandatory to perform Nasya before Tarpana?
Indication में it is mandatorily told.
Ma'am,
I have-
अर्पणं च पुडपागं च नस्य अनर्थे न शीलये. एक्चुअली विधि यही है, बट जैसे कि आगे का कंडीशन है तो थोड़ा कॉम्प्रोमाइज करते हैं, पर आपको डिसाइड इफेक्ट नहीं मिलेगा. इफ यू आर नॉट गोइंग फॉर नस्या, you will not be getting the desired effect.
So thank you, madam. The logic behind that Nasya, we know that Tarpana is designed for 7 days or beyond, or maybe 5 to 7 days or 7 to 10 days. Sometimes they do, and it's a posterior segment. And the Tarpana Dravyas are heavy molecules because it is the lipid particles. Therefore, the Shrotos to get open, that to make it Udadhatugata channelized, the Nasya is particularly designed, better absorptions and available of the drug to the posterior segment. And the second point, if the motion Nasya is could not able to perform that, depend upon the patient condition or maybe time availability, at least Pratimotion Nasya can be advised. That is my sincere, humble submission to the esteemed delegates.
Yeah, any more question, please? You may ask question. Anybody else would like to ask anything? Okay, I think that's it for today's session, sir. Now we may conclude our today's session. So before proceeding that, I would like to thank on behalf of RAV respected Dr. Praveena Nair ma'am for being with us today and enlightening us with her great deliberation and also serving as a great inspiration to all the CRAV Shishyas. So for the Shishyas, we also like to share that you are very lucky enough to get the opportunity to learn with Guru Janas and also think that also don't think that doing CRAV is the not the end, but a great kickstart with the clinical skills to stand out in the fraternity. And there are so many areas open for you, so you can utilize your potential to your greater side. So be honest, hardworking, diligent, and also disciplined to achieve the greater heights. So you may achieve better. So be disciplined and honest with all your works. Now, we also like to thank respected Dr. Sarveshwar Karsar for enlightening us with their experience, expertise, and also sharing with us and enlightening us. Both the session have truly enhanced our theoretical and practical knowledge as well. So we are very much thankful to both the experts. Thank you, sir, and thank you, ma'am. We also like to thank our respected Vaidya Trigunaji, Vaidyashi Manoj Nestriji, respected Dr. Kaustubh Upadhyay, sir, advisor Ayurveda, and Dr. Vandana Siro, ma'am, director of RAV, for their support, constant support, direction, and great motivation at all the steps. We also thank respected governing body members, our respected Guru Janas who joined with us in spite of their busy schedule. We also thank respected N. Ramakrishnan, sir, admin officer RAV, for his valuable support and guidance at every step. We thank Shishyas and all the viewers for joining with us, and also Dr. Arpita HR ma'am for wonderful enchanting of Ashwini Suktam. Last but not the least, the whole team of RAV who worked behind the scene to make this webinar a great success. Now, topic for the next webinar will be shared with you very soon. So we are very much thankful to you. Thank you, sir, and thank you very much, ma'am, for wonderful.
One more last message from my end.
Yes,
profound, what do you call the gratitude to the Gurunam Guru Trigunaji, the master, and that is his vision, this RAV, and director Vandana Madam, and the entire team, and to my delegates. Those are really, there are many seniors also I could see. Please, as Panchakarma has come to take over the Ayurveda globally for serving the humanity for different diseases, please try to practice Kriya Kalpas. Since many years we are trying to this branch to come up, and hats up to our Sridhar Yam. I was part of that. Nobody now, NPP is not there, but the team is doing extraordinarily. And with the team of Salakis are popularizing Kriya Kalpas for the best purpose of humanity. Thank you. Over to you.
Yes, thank you very much, sir. And thank you, Dr. Praveena Nair ma'am, for being with us. It was really a privilege having you both with us. Thank you. And have
My
a good
salutation to Praveena Madam also. Thank you.
Thank you, ma'am. Thank you.
Madam, thank you. Namaste.
Production potential हो रहा है